In the United States, we have thousands of isolated hospitals and clinics scattered all over the place, and they all offer a simple service: curing patients of their illnesses. Patients show up on the doorstep of a clinic or hospital where they're taken in, treated, and the clinic or hospital is paid for each service. So each time they make a patient better, they're paid for that service. So they're paid literally piecemeal to take care of these patients. And this level of transaction is happening at hospitals all across the nation. It's a product of our fee-for-service model. Now that we understand how hospitals and clinics are reimbursed, for me the next big question then is how much money is our nation spending on these fees, and where's that money coming from? Well, we have data from 2010 to answer that question. In the year of 2010, the total national healthcare spending for hospital services and physician clinic visits was $1.3 trillion. That's just under 10% of our gross domestic product. What's interesting, though, is that it's not the consumer of the service, the patient, who's directly paying for each service. Instead, there are these larger detached paying bodies, and I'll talk about those. So first, there's the government. So total government financing of healthcare represented 45% of all U.S. health spending. Second, in 2010, private businesses financed 21% of the nation's total healthcare bills. That's 21% of this $1.3 trillion. The majority of this business financing came from companies contributing to private insurance plans for their employees. Total spending by households comprised 28% of national healthcare spending. Household spending includes contributions like paying for individual private insurance, contributing or individuals contributing to employer-based programs, or direct out-of-pocket payments. So what's notable about this situation is that while the individual who shows up at the clinic door is paying a portion of the cost of their treatment, the fee that the hospital or clinic charges, maybe by contributing to an employer-based insurance plan or insuring themselves, they're not directly paying for the fees that are incurred over the course of their care. And what's more, all of these disparate hospitals and clinics actually stand to profit from the fee that they can charge to the patient. So strictly from a financial standpoint, these medical centers actually have very little incentive to minimize the cost of caring for this patient that shows up at their doorstep, because each fee that they can charge that patient directly contributes to their revenue. And they know that the patient isn't directly paying for that cost. The patient's already paid for insurance. So these medical centers actually have very little incentive to minimize the cost of caring for this patient, because each fee contributes directly to their revenue. In addition, you can see how this setup might actually disincentivize any sort of national spending on preventative care, because preventative care might actually reduce the volume of hospitalizations and clinics, reduce the number of people who are showing up on their doorsteps, and thus the amount of revenue that they can bring in. So it's an interesting system that's organically evolved, and it's all around the fee-for-service payment model. And what's really exciting is this is all changing.